Hi, I'm Dr. Vignesh, Consultant Emergency Department, Manipal Hospital, Vattur. Today, I'm going to talk about overdose and what needs to be done immediately and how to manage it further. An overdose is when someone takes a toxic amount of a drug or a medicine or any other substance. Someone can overdose on different substances like alcohol or any other medications that has been prescribed or non-prescribed medications. This can also involve the herbal remedies, which is very commonly available like these days. And not all the overdoses are fatal or life-threatening, but medical advice should be sought if overdose is suspected or if it has occurred. Try your best to stay calm. I know it's very difficult. And second thing, call 108 or any nearby ambulance services. If it is taking lot of time, then probably you can consider shifting the patient by yourself to the hospital. In the meantime, if the person becomes unresponsive but breathing and having a pulse, which you can check on any side of the neck region. In this case, you can gently turn the person towards one side. This is called the recovery position, and it helps in preventing the risk of aspiration. And if adequate help is available, with the help of them, you can gently tilt the head and lift the chin so that helps in person to breathe better. And do not give anything to eat or drink, especially the salt water, and do not force the person to vomit, okay, because this again increases the risk of aspiration. And try keeping the pill container if it is available to take it to the hospital. If the person's cloth is being contaminated with the poisonous substance, then try removing it gently and replace it with the clean garments. And if the person is unresponsive and not breathing and does not having a pulse, then immediately you have to start doing a CPR, which is the cardiopulmonary resuscitation. That should be done immediately without waiting for anyone. The management depends on the type of drug, dosage, what time it was taken, and what else was taken along with. So as soon as the patient comes to the emergency department, we'll do a complete assessment of the patient, which includes checking the vital signs and doing a general physical examination. If the person is drowsy and been vomiting for a while, then we have to secure the airway by putting them on the ventilator, which is a life-saving procedure. And secondly, we'll try to prevent the drug from further absorption, okay, by putting a nasal tube that is through the nose, and we'll give a stomach wash, and this will be effective if it is done within the first 1 hour after overdose, and then administer an antidote, which is very important if it is possible, and then do a complete blood workup and ECGs if it is needed to know the impact of overdose in the body, and then admit the patient for further management and observation. Sometimes people ask us, is the admission is mandatory? Yes, it is mandatory because some drug has got a different duration of action and onset of action. Initially the patient may be completely better. After some time they will develop some reactions. Those that need to be closely observed. So that will happen only through the admission and then observation. And once the admission period is over and the patient is completely stable, we can safely discharge the patient, okay, after taking a psychiatric opinion if the overdose was intentional. And then we can advise for the follow-up with the concerned specialties. I hope this addresses all your questions regarding the overdose. Thank you.